Well, the role of performance measures is huge because otherwise we have no way of knowing how things are going, whether the expenditures are adding up, whether doctors' efforts and patients' efforts and educators' efforts are working or not. So we absolutely need them. Plus, in addition, they also help in putting steady pressure on the medical profession to improve over time. As to negative things, there are very few. Some people think that both the burden of doing them is a problem because it does take time and energy, and if they're too rigidly applied, then they can cause some harms. But if the performance measures are dealt with in a fair and reasonable way, they can only be helpful. Well, for example, if a doctor is judged on how many of his or her patients get down to below 6.5% hemoglobin A1C, or how many have to get below 130/80 blood pressure, and they have difficult patients, or the kinds of patients that Dr. Siegel talked about, who have a hard time doing this and that, they're going to be judged unfairly. So the measures have to be carefully applied to the specific problems that a patient has.